28% of women in reproductive age have PCOS. That's absolutely the result of that transition from this type of diet to the Western diet and becoming obese.
Even if you're making those lifestyle changes so that your perhaps weight is dropping, you don't have to have the perfect BMI. It's the action of those lifestyle changes that matter, so that then you're healthier through the pregnancy. And I've had patients who lose weight through pregnancy, which if they start off at a high BMI because they're perhaps losing weight prior, and then they continue on their lifestyle changes, and then their body morphs, and at the end of the pregnancy, they're lighter than their start weight, but baby's healthy.
Yes. And, you're probably referring to people that are more categorized as obese. We're not talking slim.
No,
we have to be very clear, right?
Yes.
And
yes,
by the way, as a disclaimer, this is not your medical advice. You do want to seek a health provider and, go through this. And let's go back to the impact of metformin during pregnancy. And, because if we're looking at, how to motivate women to utilize lifestyle and health versus taking metformin, what would be the impact, the outcome potentially of using metformin on this child?
So I actually wrote a paper, I think it was published and the headline is why you shouldn't use metformin during fertility treatments, or whether you should. But the point is, metformin, other than the reasons we talked about getting pregnant, during pregnancy, if the babies are exposed in utero to metformin, there's several very concerning facts that we need to think about. One of them, metformin crosses the placenta very efficiently. So the concentration in the mother's blood and the baby's blood is the same. So whatever happens to the mother happens to the baby. Now, at the beginning of pregnancy, if we think about the beginning of embryo development, up until the blastocyst stage, embryos are totally 100% dependent on their mitochondria for ATP production. So if you don't make ATP, there's a good chance embryos which would otherwise implant and result in a good pregnancy may be lost. And there's studies showing that both in vivo and in vitro. During pregnancy, when the baby develops, metformin causes an environment which is low in energy because of the way mitochondria work. Mitochondria don't work as efficiently as they would have without the metformin. So the embryo is developing into conditions of low energy availability. You can think about it, you can compare it to conditions where a mother doesn't eat enough calories and doesn't supply the baby with enough calories. In both conditions, the baby would develop as a very efficient machine that can utilize calories in a manner that even with a small amount of calories, brain function will be maintained at all times. To do so, metabolism becomes extremely efficient to a point where once the baby is out and it's exposed to our normal, probably normal is not a good word, to the Western life type diet, which is absolutely abnormal.
Yes, the land of plenty.
Guys, Cokes and so forth. When the baby is, or the small adult or the young person is exposed to this type of energy availability, it develops syndromes which are associated with having too much energy, which is essentially obesity, diabetes, hypertension. And there are studies looking at babies that were exposed in utero to metformin when they were seven. And they already had high blood pressure and diabetes.
Oh,
wow.
Yeah.
So we have to think about the long-term consequences now that we know how metformin works. Before, we didn't know. It was easy, it was safe. Now we know how it works. There's another interesting study because it affects processes that consume energy. One of them is the production of testosterone. So they looked at what happens to male babies, male newborns, looking at what if anatomy which is dependent on testosterone during the development of the organs. And they saw signs that testosterone was not sufficient for babies, male babies that were treated with metformin during in utero. So this is something else we need to consider.
Was the mechanism bringing down, like, yeah, what would be the mechanism of action? Dropping testosterone?
Testosterone in the baby is formed in the male baby from the testicles. To make testosterone, they need a lot of ATP. So if you don't have a lot of ATP, you make less. And as you probably know, everything that transforms a female, which is the default in nature, to male, depends on the action of testosterone.
Yes.
Right.
So if you don't have enough testosterone, it's not going to happen in the same manner it was supposed to. So things are going to go wrong. Now, one of the things that they've measured was I don't want to go into too many details, but
No.
there's a way to measure certain distance, which is affected by testosterone, was shown to be shorter amongst babies that were treated with metformin in utero. So there are consequences. It's not innocent as people tend to think it is.
You're saying that they had smaller penis lengths? Is that what you're saying? No?
Actually, the distance between the penis and the anus.
Oh, wow. So the
Interesting.
perineum was shorter. So basically it kind of goes in keeping with what's going on with men who are, now this newer research showing that men who are on metformin, perhaps to treat type 2 diabetes, then they're conceiving or where their wives are conceiving, and then it's showing up as birth defects. So there's got to be some, definite reconsideration as to how we just blanket treat this, and then looking at both parents, not just the mom.
Absolutely.
As well. Mm-hmm.
Lack of energy being the biggest factor. And so again, I'm going to be sensitive to perhaps some of the women, and I know we are pretty close to time. Yeah. So bear with me. There are some women that have gone through this and now they have their children, and, who had, I'm thinking specifically if a person reached out, she had lean PCOS, was on metformin, has 2 little girls, and now she has panic. When she read the one about the male one, actually, Tanya, that was very recent. So it's like, how do we address this concern? It's like the deal is done and their kids seem fine. So, we're not going to say that it's every single case. No. There are higher risks. But did you want to speak to that, Dr. Bentov?
So it's like, if you're born to a society that eats well and you don't eat what we eat in the Western world, and you're born with a diet that does not contain a lot of sugar, your body forms in a more efficient manner. So the consequences of being so efficient will cause an abnormality once you are transitioning to the abnormal Western diet. And I also wrote another, I think, good paper about it. Mostly what I like about it is the name. It's called The Western Diet Side Story, which talks about what happens when you transition from a healthy diet, like people in Mexico before they were introduced to our Western diet, they ate healthy food. And then their bodies were formed to be efficient. They didn't have a lot of calories, they didn't have a lot of sugar, but then they moved to our Western diet type kind of availability of calories and sugar. And then they start developing, amongst other things, PCOS. If you look at the incidence of PCOS amongst people who came from South America to the US, or even in South America nowadays, 28% of women in reproductive age have PCOS. That's absolutely the result of that transition from this type of diet to the Western diet and becoming obese.
Right.
Overweight, I should say. So my point is, eat healthy. Eat healthy. So you don't need to worry about that.
Yes. Thank you. I think that's really insightful and very helpful because, you know, no matter what juncture you're in, because, you know, some people, like I said, already have the children. Some are in it. Some are just starting out. So this is a great positioning. You know, listen to this, read this podcast, watch it, and go to your doctor and question it, and see how you can work as a team and look at alternatives. Thank you so much for being with us today. And we will definitely have you back. And we will also share show notes of some of the articles that you have mentioned today. And so you go to myfertility.com and you'll check out everything there. See you guys real soon. And again, for those of you who haven't, watch the episode from my from Fertility Talks as well.